headquarters of common sense.
Talk Radio.
This waiting list. Now, I remember tweeting about a year ago that come the 2024 general election, there were going to be far, far, far more people. Well, in fact, everybody would know someone who had lost their job, lost a business, was walking down devastated, high street with shops boarded up. And every single person in this country would know someone affected economically by lockdown. But only a tiny fraction of people in this country would know someone who had died or been seriously ill from COVID. Now, the stats would bear that out for me so far. What I should have written as well, though, was, and every single person will have a close family member on an NHS waiting list. This is already a very serious issue with 6 million people on a waiting list. But we're told by Sajid Javid, the Health Secretary, yesterday in his statement to the House of Commons about a couple of days later than it was supposed to be, that we could see it rise to even 10 million people because so many people have not come forward and they may have much more serious complaints than they actually realise. What do you make of that, and how serious is this for the government?
You see, I think it's lovely that we put this story first because I felt sorry for poor old Sajid Javid yesterday when he kind of was making this big announcement, but then Boris kind of trumped him and completely eclipsed everything that he's done. I think it's quite nice to have something to look forward to for 2024, and it's always good to, plan. And only yesterday, genuinely, it was completely nothing to do with this announcement. I, just by sheer coincidence, got a letter from my GP saying that a referral that I'd had back in 2017 was just about to be actioned. So half a decade ago.
I mean, we won't pry as to what it concerns. Is it something serious or something relatively minor? I mean, one hopes relatively minor.
Yeah, I mean, in fairness, it is relatively minor. I'm not going to lie, Julia. I read that letter and I was like, oh, I'd forgotten about that. And I think that is going to be a genuine worry that people are going to... Because I do see this possibly happening. People going... Have I fallen off the waiting list? Have they overlooked me?
Oh, I mean, and that can easily happen. And again, one of the things when people get very, very upset about all these people who miss their NHS appointments, and, 10, 20%, whatever it is, don't turn up to their NHS appointments or don't turn up for their scan or don't come up. One of the reasons that is it's not because people don't care. Genuinely, the letter comes through and it's for, 9 months' time. And unless you're very anal like me, you keep your electronic diary, you've got notes of these things and a file of stuff that's coming forward because I live a busy life and I need to be in places on the right day. Lots of people, these things, unless you get a reminder, lots of people, just these things slip through their minds. And also, what the other thing is that people eventually, will be cured before something's happened or they've died. I mean, genuinely, there is a small percentage of people who don't turn up to hospital consultant appointments because they've already died of the thing they were going to have a consultation about. And that is the really big concern, the really, really serious stuff. I mean, the Health Secretary was talking about how, there's £12 billion that we're going to see raised from the National Insurance hike in April. We know that that's supposed to be for social care. It's not. Virtually all of it's going for the NHS for the next 3 years to tackle this backlog. He's admitting, though, the waiting lists are going to rise for the next 2 years because they don't know how many people haven't come forward. And the big issue is when people come forward a year or two late, people will think, well, then it can't have been something serious. No, if you don't come forward when there's some minor issue, which could turn out to be stage 1 cancer, but then you come forward when it's a very big issue and it turns out to be stage 4 cancer, then that's the difference between living and dying. It's really that simple. And it's also a difference between the kind of treatment and the extensiveness of the treatment, and therefore, who can treat you. And the knock-on effect of this is huge. And that's what we've been seeing in January this year. Was it a lot of the so-called, routine things were actually, emergencies from people not getting routine treatment a year ago or 2 years ago. This one is going to, I think, run a run. And, as COVID dissipates, and bearing in mind we've got below average death rates right now, in January and February, compared to normal years, we really do need to focus on people who don't have COVID for the next few years, don't we?
Yeah, and I think that's going to have a real impact on other public health messaging as well, because exactly like you say, the sort of received wisdom is always, if you've got a problem, go to the GP, get it fixed straight away. But if there's also the messaging out there of like, oh, you're going to be waiting, sort of 18 months or whatnot, people are going to go, you know what, actually, I'm just going to leave it. I'm not going to go.
That's a very good point. You'll think, well, what's the point? And of course, then they're further down the list. And again, but the key thing is also someone going to the doctor about one thing, and the GPs have told me this so many times on the show and off air, that especially middle-aged men, and they turn up about something, some specific thing, or maybe they've got earache or something like that. And then they say, it's the comment as they turn the door handle, and they're just turning, they go, oh, by the way, there was this thing. And that's nearly always the thing that the doctors say is actually the really serious problem. Like they've not been sleeping, they've been exhausted and tired. Again, these could be signs of just no issue or a huge issue. And that's the key thing. As a GP's daughter, I didn't hesitate to contact doctors during even the height of COVID. I'm sorry, but life still goes on for other people who don't have COVID. And that's the thing, is that it wasn't just people not being referred and the NHS closing down. It was an awful lot of people feeling they were doing the right thing. They were told your job is not to pay the taxes to support an NHS to look after your healthcare. Your job is to protect the NHS. And they thought they were doing the right thing by not contacting the doctors. People didn't take their children to A&E because they were worried that they, they'd catch COVID. Again, it wouldn't have been a risk for a small child that was healthy otherwise after an accident, and that they shouldn't be burdening the NHS when A&E was pretty much empty everywhere for months on end.
Yeah, and I think one of the things that gets me about this new policy of I was reading that apparently they're going to use sort of more online platforms, and I think you're absolutely right when you say things like sort of middle-aged men or men who are a little bit more mature. I always think of my mum, and if I say, she can't even program the oven clock, let alone anything else. So if you say, oh, here's a new app that you've got to get used to, she's not going to use it.
I had to book an appointment the other day, just get an online chat about something so minor for my kid, but something that needed to be done. And logging on, my details, her details, and genuinely, I'm on the 40th page of questions about a minor thing. And you just think, we're just wasting each other's time at this point, and a lot of people would just give up as opposed to putting a call into the receptionist as well. And I think we've got a really big issue there. I don't think they understand. I'll persevere because I know it's something that needs to be dealt with, but a lot of people won't. And I think that is a very big issue as well. Let's talk about the reshuffle.
Good talk.
Hot talk. Bold talk. Talk radio.
Listen on your smart speaker.
Watch it live on your smart TV.
The world headquarters of common sense.
Talk Radio.